Hello, my name is Sophie Cortez, practical nurse student. Today I will do my lab skill assessment. First, I will do hand hygiene and I will read doctor order. Okay, I have doctor's orders. Okay, patient's name, Crash Otto, hospital ID 121-23-93, date of birth 1960, February 20, allergies to morphine, male, primary diagnosis for L2 compression fracture. Today, doctor ordered discontinue morphine and administered ketorolac 30 milligrams every 6 hours intramuscular while awake for 5 days and then reassess. So I didn't print on my monograph, but I have my drug guide here. And I have here ketorolac information about the medication. So I see the doctor ordered 30 milligrams and I will double check here dose for adults, intramuscular single dose 30 milligrams. So that's the right dose and the right route. It also has some information about the medication. Okay, so I'll check the information about the medication and I will do my first check with the MARS. So I have in the MARS Crash Otto, patient's name, Crash Otto, male, hospital ID 121-23-93, hospital ID 121-23-93, date of birth 1960, February 20, date of birth 1960, February 20. Today's date, November 30, 2020. It is 12 o'clock and we have to administer 30 milligrams every 6 hours of ketorolac intramuscular for 5 days while awake. I have doctor ordered ketorolac 30 milligrams every 6 hours intramuscular while awake for 5 days. So Mars match doctor order. That was my first check. I will bring the medication so I can do my second check. This is a practice vial, don't have any information about the medication. So I have Crash Otto, male, hospital ID 121-23-93, date of birth 1960, February 20, today's date November 30, 2020, and it is 12 o'clock. We have to administer ketorolac 30 milligrams every 6 hours intramuscular for 5 days. We have ketorolac 30 milligrams per 1 ml, expired date April 2025. This vial contains 2 doses because it says 2 ml intramuscular route or IV. So I got the correct medication. The reason of this medication is administered is because ketorolac is a pain medication for a short term. Since our patient had allergies to morphine, doctor want to give this medication only for 5 days and then he will reassess. Now that we know, I'm gonna grab a sticky note. So it's 30 milligrams equals 1 ml in this vial. It says 30 milligrams equals 1 ml. So I will withdraw from the vial 1 ml. Now that I have all the information, I'm gonna bring my supplies. So I'm gonna choose a 3 ml syringe. This expired date April 2024, hasn't been opened yet. Since needle injections for intramuscular are between 18 to 27 gauge, I have this one with a safety glide 21 gauge. I also have this one 25 gauge. So I chose the 21 gauge, expired date April 2024. I also have a blank fill needle without filter since it's a vial. Expired date April 2024. So this is this supplies has been already open since I've been practicing, and I'm gonna bring alcohol swab. So first I will clean the vial for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm gonna let it air dry. Well, this one is brand new. And my blank needle. I'm gonna withdraw air. I'm gonna withdraw the same amount that I'll need for the medication. So I have 1. Okay, I'm gonna make sure I don't have any bubbles. It looks like a little one here. Okay. Okay. I have 1 ml and I don't have any bubbles here, but when I check, when I change needles, and I will do 1 hand scoop technique. And I'm gonna make sure. Okay, so I don't have any bubbles, and I'm gonna use the medication that I have in my blank foil needle to prime my next needle. So I will pull back a little bit to withdraw all the medication that I have from the blank foil needle. So now I'll change needles. I'll discard this in the sharpers container. I'm gonna open my safety glide needle, and I'm gonna pull back. So I'm gonna prime my needle, and I'm gonna make sure I have the correct amount. Okay, I have the correct amount without bubbles. Now that I have the correct amount, I will do the label. Oh, this is a sticky. In the label, I'm gonna use the mark. So I have Crash Auto. I'm gonna include the hospital ID here, 121-23-93. Today's day, November 30, 2020. It is 12 o'clock, and the medication is Ketorolac. Milligrams equals 1 ml. This is an intramuscular route. So I have in my label Crash Auto Hospital ID 121-23-93, November 30, 2020. It is 12 o'clock. Ketorolac 10 milligrams, 1 ml, intramuscular, and my initials and designation. So I'm gonna put it here in the cap, so I don't wanna cover the medication here. Okay, now I will do my third check with my vial, my label, and my mark. So I have Crash Auto, male, hospital ID 121-23-93, hospital ID 121-23-93, date of birth 1960, February 20. Today's day, November 30, 2020, November 30, 2020. It is 12 o'clock. Drug, Ketorolac 30 milligrams, Ketorolac 30 milligrams per 1 ml. Intramuscular route, and my initials. So I've done my third check. So I will leave this vial in the med room, and I will bring all my other supplies to the patient's bedroom, and I'll bring my mark, my medication, and the rest of my supplies. First, I will go to the patient's room. Hello, my name is Sophie Cortez. I'm a practical nurse student. Today I have an order to administer Ketorolac. Is medication. Is that okay for you if I come in? And he says yes. So first I will do hand hygiene. I will close the curtain to give you more privacy. Could you please tell me your first and last name? And he says Crash Auto. I'll check the wristband. Crash Auto. Could you tell me your date of birth? And he says February 20, 1960. And here says February 20, 1960 on the mark. And I'll check here hospital ID 121-23-93. My mark says 121-23-93. My label says 121-23-93, so I got the right patient. So first I will assess my patient's level of conscience. I will assess vital signs. I will also assess for pain, and then I will explain the procedure and the medication. This Ketorolac is a pain medication that the doctor ordered since you have been having allergies to the morphine. We are gonna use this medication instead. This medication is for short term. It's only for 5 days, and then the doctor will reassess you again. Okay? Do you have any questions for me? He says no. Okay, so I will use your ventrogluteal site to do this medication since it's a large muscle. Is that okay? And he says, yeah, it is okay. So first I will grab clean gloves. So I assess my patient's level of conscious, as I already said, pain, vital signs, and now I will assess my patient's skin. When I'm gonna do the landmarking, and I'm gonna look for hematomas, redness, or lumps, abscess, tenderness, or muscle atrophy in the ventrogluteal muscle. Well, since I don't have any volunteers with me today, I'll print. I already have a picture that I already print, so I'm gonna use this one. So I will ask my patient to lay on the left side, and I will do the landmarking on the right side. So since I'm gonna do it on the right side, I'm gonna use my left hand, and I'm gonna put, I hope you can see here, I'm gonna put my left hand to do the landmarking. So I'm gonna put the heel of my hand in over the greater trochanter. I'm gonna put my, can you see that? Yeah, I'm gonna put my thumb is pointed at the groin area of the patient, and the index finger here, the anterior is going to be on the anterior superior iliac spine, and then my middle finger, I will extend it here along the iliac crest, and on the V shape I will inject the injection. I hope you can see. When I can usually they usually put the alcohol swab in the V shape here, so they know where they have to put the injection. So this is my landmarking. Okay, so I'm assessing the skin. I already checked for tenderness, lumps, hematomas. Everything looks fine. I have alcohol swab here. I'm gonna make sure the bed is on the working level position before we administer. We have some gas to apply at the end. I will clean the site for 30 seconds, and starting from the middle. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I will let it dry. I will ask the patient before administering if he has any questions. Do you have any questions? And he says no, he don't have any questions. So I have my needle here. I will use the C-track technique. I will hold the skin taut to one side, and then I will inject the 90-degree angle. Is 1 ml every 10 seconds. So I have 1 ml, so it's 10 seconds, and then I will wait 10 more seconds before I remove the injection. Okay. I will also let my client know that he might feel a little burning on the site of the injection, but it's something normal, and he won't even notice. Okay, so I'm gonna remove the cap. Okay, and I will dot here, and I'm gonna inject on the 90. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and I'll remove. I will do the safety sharpest container and press pressure don't massage. I will also going to let my patient know that this medication is scheduled every 6 hours, so it is very important not to skip a dose, and the medication might make him dizzy or drowsy, but this is normal. It also could increase the risk of blood, increase the risk of blood pressure, sorry. But I will come back in 30 minutes to evaluate your and do any vital signs and check if you have any allergic reaction of this new medication. Those are my teaching for the patient. I will give you the call bell if you feel anything strange or you don't feel well. You can ring the bell. We'll be back. Do you have any questions? He says no. So now that before I leave the room, I'm gonna put this in the trackers container that I have here. So 12 o'clock, I administer Ketorolac 30 milligrams every 6 hours intramuscular for 5 days. I'm gonna put my initials. Okay. Before I leave the room, I'll make sure he's safe. I'll put the bed low in the lower position, give the call bell, the both sides rail are up. I'll do one more time hand high washing before I leave, and I'll bring all the supplies that I bring with me. Okay, have a beautiful day, and I'll be back in 30 minutes to evaluate you. Okay, bye.